Welcome everybody to the first Practice Support and Improvement virtual education series, Working in General Practice. This is our first session in a series of education series that will be available online, and the first session will be on privacy and confidentiality. I'd just like to start with an acknowledgement of country. I would like to start this session by acknowledging the people of the Wiradjuri Nation as I am sitting in Bathurst today, and the different nations on which people are sitting today. I would like to acknowledge that we work on the traditional lands of many Aboriginal clans and nations, and pay respects to elders past, present and emerging, and acknowledge their continuing connection to the land, water and culture, and their contribution to help shape the communities in which we all work and live. We are committed to working in the spirit of partnership and collaboration with our region's Aboriginal communities and people to improve health, emotional and social well-being. I welcome Aboriginal and Torres Strait Islander people who are viewing this session today.
Hello everyone, my name's Allie Sullivan and I'm a Practice Support Officer based in our Dubbo office. I've been with the Primary Health Network for 4 years now, both in an administrative role and the last 3 years in practice support. I love my work and I'm really glad to be here to work with Fallon and presenting this with you today. I've worked in general practice before I started with the PHN, a very small practice, and I work both as reception and in a practice management role. And I'd like to just introduce briefly to you Fallon Gray, and she's the manager of the Practice Support and Improvement team.
Thank you, Allie. So I manage the Practice Support and Improvement team with the Western New South Wales Primary Health Network. We cover quite a large geographical area in New South Wales, and we have 6 practice support officers across our region. My background is in practice management, and I did start in reception role several years ago. I've managed multiple sites in rural and metropolitan areas, and I have a strong passion for changing the health outcomes in our remote regions that have harder access. Today, our learning outcomes for this session will be to differentiate between privacy and confidentiality. We want to recognise and comply with the requirement to protect patient confidentiality and identify different types of confidentiality breaches. We're going to discuss the mandatory requirement for general practices to have their privacy policies complying with the APPs or Australian Privacy Principles. Privacy and confidentiality. We often use the terms interchangeably. However, they mean distinctly 2 different things, particularly from a legal standpoint. Confidentiality refers to a person's information that they share with their GP and practice. This information cannot be divulged to a third party without the expressed consent of the patient. Whereas privacy refers to the freedom from intrusion into one's personal matters and personal information. So in a general practice setting, we comply with both privacy and confidentiality, but confidentiality is an ethical duty, whereas privacy is common law.
Just continuing on with the privacy and confidentiality, the doctor-patient relationship, it establishes an implied contract of confidentiality since the doctor's in a position to help you by collecting and analysing otherwise private information. So all staff in a medical practice, you must sign the confidentiality agreement with your initial employment contracts and have training in your induction. If this is something you're unsure of, just talk to your practice manager to make sure that this has been done. So privacy and confidentiality, A deliberate breach of confidentiality. Now, this is terms for instant dismissal. The practice's privacy policy should be displayed in the waiting room or the practice brochure, and also on the practice website. So we'll look at this a little bit later in the presentation, and we've got some links where you can actually find a privacy policy, the brochure from the RACGP website.
Thank you, Allie. So confidentiality is highly important, particularly in the healthcare sector. It's first and foremost in all roles in general practice. Confidentiality benefits patients by providing them with that secure environment so they can seek the legal advice that they need. By providing that confidential environment, the patient will be more inclined to give a full and frank account of their illness. And that's important in correct diagnosis and understanding where the patient's health lies. Maintaining confidentiality also supports confidence in the healthcare system, and it allows our patients and communities to have trust in all healthcare services. It also expresses respect for the patient's autonomy. The patients are trusting us with their personal information, so it's showing them respect for that share of information. People have a right to choose who they want to share their information with, and they expect that the doctors and staff will hold this information in confidence. There are a few instances where it can be released by law or public interest considerations. Some examples of that would be if there was a subpoena for a patient's health records, and there's some other situations that are legally required if a patient's life is at risk, but there are quite strict procedures behind these. Today, Allie and I are going to look at the three most common types of confidentiality breaches that you'll experience day in, day out in general practice. The first one is a verbal breach of confidence. So this is where you discuss a patient's conditions with your family or friends. This could be as simple as telling a family member at a barbecue on the weekend that you saw Auntie May in the practice on Tuesday. You cannot tell patients conditions or if a patient presents to a doctor's surgery. A visual breach of confidence would be something like if you left a patient's file out or they had access to a paper like a faxed information or electronic information on a computer screen. If that was left in full view of the patient and another patient could see it, it would be a visual breach of confidence. The last one is a little bit more difficult, and that's the auditory breach of confidence. So this is when you're discussing patient matters in a loud and unprofessional manner within hearing range of others nearby. So that could be if you are discussing a patient's results or something at a front desk and there's other patients in the waiting room listen. And Allie and I are going to dig into this a little bit later in the presentation.
Thanks for that, Fallon. Let's just have a look now at the visual and audio breaches, just in a little bit more detail. So your visual breach of confidence, this is confidentiality. This is where, as Fallon mentioned before, so hard copies are left where patients can see them on the reception desk. That's files, any documents like your pathology forms, fax reports, etc., and any written notes, just even point notes that you've written during the day that's something you have to tell the GP later. Just be really careful, and if you do have to leave the desk, just make sure you flip them over so nobody can see them. Your next one's probably looking at your just your computer screen as well. Fallon will talk about that a little bit more. I just think it's really important. It's very easy. You think people can't see your computer screen, and it's very easy for them to have a look. So make sure your screen saver is on that and it times out. Just always remember, so don't leave any hard copies, as I said before, for your patients to view. Put them face down. Restricted access, physical access.
So restricted access would be important just to make sure that your fax machine isn't accessible by a patient. And no printing of patient documents at the front desk with the exception of receipts. So it's really important, as Ali mentioned, that the physical access is not allowed by patients. So you don't want a printer that the GP or clinical staff are going to use to print patients' results at the front desk, because if a doctor potentially prints the result for a patient and you have stepped away to the bathroom, the result could be exposed for someone else to see. So that would be a good example of restricting your access.
Yes, yes. Thanks for that, Fallon. Just moving on now to the next slide. So your computer visual and breach precautions. So as we mentioned, the screensavers and passwords must be in place. Restricted physical access to all IT devices, including the server, workstation, screens, fax machines and copiers. Your position of the screen. Patients not permitted behind the reception desk at any time, and just log off your computer if you're leaving the workstation. Fallon, I'll let you talk about the auditory breaches if you like.
Thank you, Ali. So another way that you could make sure, just touching again on the computer visual, and it is in the accreditation standards, is also to have the screensaver in place at every workstation. I think we've mentioned that already, but it's just really important that those screensavers are set and that the time frame's appropriate for the practice. Particularly in the doctor's workstation. For example, the doctor might need to step out to the nurse room to get a vaccination, so we don't want the computer available for a patient to see. So moving on to the auditory breaches. Auditory breaches can occur when you speak loudly about patients, when you speak to a patient that is standing at a reception area. Remember, there are other patients listening when you're speaking to someone at the front desk, so just be mindful of that. We understand that this is extremely difficult, but your tone and your volume of your voice is important. When you're speaking to a patient on the phone, and when you're speaking to a patient or a colleague on the phone as well. So some auditory breach precautions that we can take are to be conscious of the volume of your voice. It does travel in surgery due to easy clean floors and open plan areas. If you do need to discuss something confidential with a patient, maybe consider going to a private room if that's an option that you have available, or taking them down to another end of the front desk. If you have got a confidential phone call, again, consider taking it to a private room, or if appropriate, you could look at transferring it through to the nurse or someone that has more of a private environment to take that phone call. Discuss patients with a colleague only when required. You do not discuss patients at the front desk unless you need to, and it really should be done away from the reception area. The other areas that we can focus on to avoid an auditory breach is to think before you speak. And something that I like to do as a receptionist and let my team know as a practice manager is to put yourself in the patient's shoes. If you were the patient who had the pregnancy test or the sensitive information being discussed, would you like somebody else to hear it? The answer is no. So just always think before you speak. Can other patients hear me? Scanning the waiting room is an important way to make sure that nobody's sitting right on top of you or sitting behind the desk unable to see them there. Am I able to be overheard speaking to the patient? Again, just always be mindful if someone's around. Is my volume too loud? I appreciate that this is also a difficult one, particularly when we do have some elderly patients that we do need to speak louder and clearer for. But again, it's just monitoring your environment and thinking about what you say before you speak. Do I need to take it to a sensitive room? Always remember that that's a possibility, or as I said, potentially transferring the phone call, to your nurse or manager if they have a private space that might be more suitable for that call. Ali, I'll hand over to you for the next slide.
Yeah, thanks, Fallon. So what can we do in a practice to maintain patient confidentiality? And just a few helpful little tips for you. So playing music is quite a good way to allow in the waiting room so that patients can't hear so much behind the desk what you're talking about. Just make sure that it's not too loud, that it's actually not a hindrance to them. Provide ways to allow confidentiality for patients when checking into reception, providing ways to allow for the patients when they're attending their accounts, and providing a way when they're booking their next appointments. So this isn't always easy, especially if it's a small waiting room and with the reception desk there. If there's more importantly, though, little things like just the volume, as Fallon mentioned before, of your speaking voice, trying to lower it. If it's soundproofing's available, especially if in the consult room, if it's quite close to the waiting area, just making sure that nobody can hear what's happening in the room. A little bit later, we're going to be a role play based on the auditory breaches, which will be quite helpful, we hope, for you. Now we're just going to have a little look at the privacy policy. So we mentioned this earlier in the slide, and we'll just go through a few things. Why do we need a privacy policy in our practice? And I guess for and foremost, it's accreditation. It's a flagged indicator within criterion C 6.3, which reads confidentiality and privacy of other health information. So there's 4 indicators there, all 4 are flagged. And what is suggested, or what is a must for your practice if you're going through accreditation, is to actually have a privacy policy in place. So it can be within your policy and procedure manual, as well as a small brochure or something at the front desk. So if patients do want to read it, they have to have access to it, and then you can just hand it over. They can read it there while they're waiting. They can take it with them. So just the next slide, thanks, Fallon. And also to comply with the APP, which is the Australian Privacy Principles. There's 13 points within that. I've just sort of picked the first one, which states an open and transparent management of personal information. So this is basically saying that health information, it is considered sensitive, and it can only be collected with consent in line with the APP. So we need to collect it in a sensitive nature, and we also need to let the patient know that we are collecting it, and that is part of the privacy policy. It will state how we collect it. It'll also a little clause about any de-identified data that's also shared with stakeholders. Thank you, Fallon. Okay, so a little bit more about the privacy policy. So it needs to be accessible. So as I said earlier, it needs to be easy for the patient to have, and you usually have it either there in the waiting room or close to reception so she can give it to the patient. It needs to be written in a format that's easily can be read by the patient. So the actual templates, I've put some links here for you. So there's a template for the larger document, and then there's also the brochure as well, which is, I find the brochure a very good little resource. It's set out nice and simple, but it covers everything that's in it. Okay, so we're just a role play now and a couple of scenarios for you to, we'll have a talk about each one and what we could do and could do differently in certain situations.
Thank you, Allie. And while we get ready for that, I might just remind you all that we do have practice support officers in place across our region that can help you to access these forms and understand them for the rest of your staff. Don't forget that for those patients that need a translator service, you can use the TIS or the translator interpreter service. And for patients that might be vision impaired or need assistance to read such information, just remember that we need to offer alternatives for these patients. I'm just going to share my screen so Allie and I can step you through a little bit of a role play to have a look at some privacy and confidentiality situations. Oh, hi, Damien. This is Alice from Dr. Feelgood Surgery. I just want to let you know that the doctor would like to see you about your recent STI check. It's quite urgent. If you could give us a call back, I'll book you in with the doctor about these results. Thanks, Damien. I'll probably see you tonight at the barbecue. That's if you don't need to cancel due to these results. See ya! We'll just pause for a moment while you have a think about that scenario.
Okay, so let's just have a think about that situation. Firstly, I think it's important to note that the patient in the waiting room was quite close to the receptionist. So this is probably the first thing that we would say not to do, not to be too close in that reception area. Space your chairs out as far away as you can. I do realise a lot of waiting rooms can be small if it's a small practice, but just be very conscious of that. The next thing is, I guess, Alice from Dr. Feelgood Surgery, she was talking in quite at a high volume. So the information is sensitive. We just need to, any information that we're providing, and we shouldn't be, giving too much at all. But she was speaking very loudly indeed. So that's just an example of keeping your volume down. Don't mention results. Don't make the call personal or social, even if you do know the patient. I know it's hard in small towns and small practices. Also, to just be aware that the patient's waiting, we can't be guaranteed that they're not going to be saying anything after they leave the practice. So if they do hear something, this can start gossip to put two and two together. They might come up with 4, they might come up with 6. So just be aware of that as well. And probably to, if you can't speak to the person, maybe decide if you really do want to leave a message. Maybe it is best to notate it that you've tried. You did not leave a message, and you keep trying that patient until you can actually speak to them directly. Fallon, do you have anything to add on that?
Thanks, Allie. I think you've covered the most obvious breaches there, but you can see how easy it is to happen. Obviously, the results was a huge no-no, but the volume, and when you are talking to someone that you do know, you can get caught up in that moment. So just to reiterate the fact that volume is important, knowing your surroundings are important, who's listening to the call. Never mention results. As a receptionist, you're non-clinical and you shouldn't be sharing that information, even though we do indirectly come across it. Make sure that the call is professional. Again, we want to put confidence in our patients and communities in the healthcare system. And I think that that's all for that one, Allie, but we can
Yeah,
certainly dig
thanks,
into
Fallon.
that further. Yeah.
Yes, okay. I've just got a couple of other little scenarios that they're very brief, and I'll just quickly go through them with you. So first one being is a patient. It's a small town. The receptionist, knows the patient well, and for that reason doesn't identify them correctly when they present for their appointment. So the receptionist marks the patient down as waiting, but in fact marks the wrong person and marks the father down because they have the same name. Now, normally the doctor would have picked this up, but he's away and there's a locum on duty, so he's unaware of the patients. So the needless to say that the consult goes ahead, a script's given, the pharmacist picks up that the script is actually meant for this patient's father, not this son. So it's I guess unfortunate that for many reasons it could have been nothing further happened here, and the pharmacist thankfully picked it up and the problem was resolved. But just to stress too, I guess things we could do better is just making sure you identify patients as they present using the 3-point identifier. Just concentration. So mistakes are common in small practices where staff know patients socially, and it's hard to ask people we know for their identification, but it's extremely important that we do this. And just make sure if you're uncomfortable asking people to identify, we do have the 3-point identify poster which can be hung in the reception area, so people are aware what they have to do when they present. So just another example, and this one's a little bit to do with faxing. So a specialist referral was faxed. Unfortunately, the fax number was entered incorrectly, and the referral went to a panel beater instead of the specialist. The panel beater rang just to say, look, I have received this. He was asked to destroy it, which he did. The patient was contacted and told them what happened, and apologies. Once again, nothing went further. The patient accepted the apology. But these are, I guess, just thinking about it, you know, how important it is that we look at using secure messaging portals like Argus, little things like that, and just double checking everything is really important. Even if there's other staff there, maybe get them to double check the numbers, especially if you're faxing important information. And if there is fax, the disclosure statement still needs to be written on the fax at the bottom there for that one. Okay, thanks, Fallon.
Thanks, Allie. And I might just point out as well, since it's come up in the last example, if you do have a breach like the one where the practice has accidentally faxed a result to a panel beaters, there is quite a process in place for mandatory data breach reporting as well, but we will be covering that off in another one of our education series moving forward.
Thank you.
Thanks, Allie, sorry. I just had one more to add as well that Allie and I
Oh,
were
good.
recapping on this morning. This is one that Allie and I have attended an event session on, and it's an easy breach. So particularly with young staff and in the day of social media. So we live and breathe social media, Instagram, Facebook, Twitter. We all are so engulfed in living in the online platform. There was an example a little while ago in a small town where a young receptionist had a patient come in and she had some glamorous shoes on. So the patient had these beautiful shoes and the receptionist was completely in awe of her, and she asked if she could take a photo of her shoes, to which the patient was okay with. But what she didn't ask, and what she shouldn't have done, is go on to put the photo of the shoes on her Facebook page and say, I love these shoes are beautiful, or whatever she put on there. But she put a photo of these patients' shoes on her social media. It is known where this patient works. So what she's done is advertised the fact that that patient was there. What happened as a result of that is that somebody else recognized the shoes and the feet and the person in which was at the surgery. So what this receptionist had done indirectly is told everybody that that woman was in that practice on that day. And that is an indirect breach of confidentiality. So I think that reminds us of the fact that we do need to be very mindful of what we're putting on social media, not just photos, but what we're writing on social media, because we are working in a professional environment. And I can't reiterate enough the importance of patients and communities having trust in our system. So it's probably better that we keep our work life and our personal life quite separate, particularly on social media. Okay. Just flick to the next slide. So Allie and I would just like to make a few acknowledgements for some of the information that have gone into today's slides. The following organisations are acknowledged for the resources that we've used to develop this material. The RACGP, HotDoc, AVANT, OAIC, Beyond the Reception Desk and YouTube. So these are sites and information resources that we use quite regularly. As this is a recorded webinar, we can't have the floor open to questions, but Allie and I would like to invite you to contact Allie or any of the practice support team if you do have any questions about today, if you require any further clarification. The links will be made available, but if you would like some help or support to access the information or to make them more personal for your practice, please don't hesitate to call us at any time. So
Thanks,
sorry,
Fallon.
Allie, I'll hand over to you. Thanks, Dom.
Thank you. Thank you, everyone, for listening. I hope you found the webinar helpful. There's a short survey here. If you could please complete it, and then there's a certificate that you can have put in your folder. Good to have for accreditation. So thank you very much. Thanks to Fallon. Thanks to the CPD team. Bye.
Thank you, Allie. Thank you, everybody, for your time.